do, I believe, have Senator Jo Comerford. Senator Comerford, are you?
I'm here. Thank you so much, Mr. Chair.
There you are. The floor is yours, Senator Comerford.
Well, thank you very much for allowing this remote testimony, chairs and honorable colleagues on the committee. I am here to offer testimony in strong support of S1293 and H2070, which is a resolve establishing a special commission on paid family and medical leave for public employees. I filed this bill with the wonderful Representative Natalie Blais. Rep. Blais will also testify. Both of us learned about the need for this legislation from a shared constituent who's a new mom and really the best advocate. I believe she's also going to be testifying in front of the committee today. Our constituent discovered in her first trimester that as a public employee working for an educational collaborative, she wasn't eligible for paid family and medical leave, even though she'd previously paid into PFML in another job. Her current employer hadn't opted in, citing budget constraints, and she was left to care for a newborn without the program support, using up all her sick leave with only a few days to cover future needs, and she returned then to work. I'm sure the committee agrees it's a situation we don't want any public servant to face. So Massachusetts, and I'm proud of this, and I'm sure our colleagues are too, we have one of the strongest PFML programs in the nation, but because the law requires employers to cover part of the cost, municipalities and school districts, many of which, as you know, chairs, are already facing significant financial challenges, they're not required to participate. As a result, largely these public employees, and this is teachers and school staff, municipal workers, are left out. And I believe this is inequitable. Rep. Blais believes it's inequitable, and it threatens to undermine our collective values as a state. So this bill creates a special commission to study the socioeconomic impact of extending PFML to all public employees and identify and recommend practical funding solutions. It's, I believe, a thoughtful step forward. It's grounded in equity and fiscal responsibility. So there are a number of strong proposals being heard at today's hearing. Thank you. These bills offer also smart solutions to these issues faced by municipal and school district employees. I appreciate this committee for looking hard at PFML and these proposals so carefully and helping us all chart a path forward that honors our public servants and makes good on that Commonwealth promise to provide paid family and medical leave to our residents. So thank you so much again for allowing this. And I'm, of course, happy to have questions, but I know you're going to have many proposals before you.
Great. Thank you, Senator Comerford. Any questions from committee members? Seeing that there are none, just thank you, Senator Comerford, for raising this issue and the need to, well beyond just schools, but all public employees as well.
Thank you so much, chairs and committee, and I'm grateful for my constituents. As you know, we get the best ideas from the people we work for. Great. So thank you very, very much.
Thanks, Senator Comerford. Take care. State Representative Natalie Blais, have you joined us?
I am here.
There you are, Representative.
It's good to see you.
Nice to see you too.
Thank you for hosting me from Western Massachusetts. Chairs of the committee, Chair McMurtry, Chair Oliveira, I really do sincerely appreciate you taking my testimony. Members of the committee, I am here very briefly, very quickly, here to testify in support of S1293 and on the House side, H2070. This is a resolve establishing a special commission on paid family and medical leave for public employees. Senator Comerford and I were contacted by one of our constituents who, as an employee of a public employer, was not eligible for paid family medical leave. You'll hear me refer to this as PFML. We have conversed with her and through email and phone calls and Zooms over the last year to talk about the difficulties that she has encountered as a public employee attempting to access PFML. She learned in her first trimester that she was not eligible for this program in the state. She had no choice but to take time off to care for a newborn. She exhausted her sick leave for the year. When she returned to work, she had only a couple of weeks to cover any additional needs for her family. So this bill is intended to establish just a commission. We want to be able to make sure that we are looking at this comprehensively, that we as a Commonwealth understand the costs. And so this is a commission to begin to understand the impacts of what it would mean to extend PFML to all public employees and to make recommendations for achieving that universal PFML in Massachusetts. We believe that this is an important first step. We don't want to jump to the end. We want to make sure that we understand what this would mean financially and socioeconomically for constituents of the Commonwealth who are public servants to Massachusetts as a whole. So again, this bill is intended to simply establish a commission to begin to look at what this would mean for our constituents and what the cost would be to the Commonwealth. We have been extraordinarily moved by our constituent who has been deeply impacted by not having this opportunity, by not being able to access PFML. And we offer this legislation in support of her and her family. And hopefully the committee will see that this is something that we should be looking at, and will report this bill out favorably to establish a commission. This is the first time that this bill has been introduced. We welcome the opportunity to work with the committee. If you see fit to have changes made, we welcome that conversation and really do sincerely hope that you will consider reporting this bill out favorably. Thank you, chairs. I appreciate your flexibility. I appreciate you taking me out of order. And it is wonderful to see you remotely here from Western Massachusetts.
Thank you, Chair Blais, and I wish I was in Western Massachusetts as well right now.
It is a beautiful day, Mr.
It
Chair.
is absolutely gorgeous. It was actually a nice drive in. Any questions from the committee members? Seeing that there's none, just thank you for raising the financial piece of this. I think we've heard from many of the organizations representing educators, and they are looking at fair share dollars to be used for an educator extension. But obviously, there are so many more public employees that your commission is looking at to get a comprehensive look at how much this would cost, whether it's school districts or municipalities and the Commonwealth as a whole. So thank you for filing, and thank you for your testimony.
Thank you, Mr. Chair. Chair McMurtry, Chair Lovera, thank you for your time. Committee, thank you for your consideration.
Moving on to, is Katherin Hudkins here? Hi, Katherin. You are a licensed clinical social worker, I believe, with the early childhood mental health and an early childhood mental health consultant. Thank you for joining us.
Thank you very much, chairpersons and members of the committee. Great introduction. My name is Katherin Hudkins, and I'm a clinical social worker and an early childhood mental health consultant in Sunderland. I've also been introduced twice by Senator Comerford and Representative Blais. I'm the constituent that they were referencing in their testimonies today. And most importantly, I am the sole parent to one-year-old baby Toby. My testimony today serves to support 3 bills that are here for expanding PFML and one around expanding parental leave. In 2019, I was overjoyed to start paying into PFML while working at a Boston hospital, secure in the knowledge that I'd have that benefit when I became a parent. After serving on the front lines through COVID-19, I began working as an early childhood mental health consultant at an educational collaborative. In 2023, when I was 8 weeks pregnant, I was shocked and devastated to learn from HR that public employers were excluded from the mandate and ours did not participate, and that I couldn't even use it despite my years of paying in. I left work that day and cried in my car, got an ice cream sundae, and vowed that I would fix this for me and for other families left behind. Public employees like me, along with teachers, municipal workers, and thousands of others, are excluded from a program that was designed to support families at their most vulnerable. PFML was supposed to ensure we don't have to choose between caring for a new baby and maintaining financial stability, and I had to sacrifice both. Instead of getting 20 weeks of paid leave through PFML, I cobbled together 16 weeks off using all of my sick and vacation time and asked loved ones for financial support in lieu of baby gifts. When I returned to work, I faced 10 months without any paid time off as the only parent and wage earner. I strained myself to take the absolute minimum possible, yet I still ended up needing nearly a full month of unpaid leave for illnesses including my baby's hospitalization, COVID, well baby visits, school closures, and the times when my baby just needed me. If I'd had access to PFML, I could have taken a real vacation this year without worry. I could have enjoyed critical bonding time instead of spending hours of my work time pumping. I could have been fully present with my sick child instead of working through naps or trying to cover meetings while my baby had a fever. I could have gone to my own medical appointments. Another sad fact of this inequity is that if I want to have another child, I'll have to leave the public sector because I can't afford to go through this again without paid leave. That means our already strained public systems could lose experienced professionals like me because we're being forced to choose between health and family or public service. There's also a broader picture. My area is facing a severe shortage of infant child care. When parents have access to PFML, it keeps babies with their caregivers longer, easing demand on an already overwhelmed system and doing what's best developmentally for babies. Massachusetts already knows that paid leave is a good policy, but until we include public employees, it remains an incomplete promise. I urge you to expand PFML as much as possible, as soon as possible, and show every family in Massachusetts that their care matters no matter where they work. Thank you.
Thank you. Thank you, Katherin, for your testimony. Do you have any questions from committee members? I just have one question. Did you work for CES at the time?
Yes.
And so I think that's kind of for a lot of people, educational collaboratives are school districts that come together to provide certain services to school districts as well, and they're a little bit unknown to a lot of people. I was on a board for one for 10 years in the Lower Pioneer Valley, so I know them well. Yep. And so there are bills impacting teachers. Would that extend the teacher bills to educational collaboratives as well, or would that be just under kind of more greater municipality? I'm unclear.
My understanding is that there are 3 bills
Yep.
being heard here today. There's the one that the representatives, Senator Comerford and Blais, shared that would establish a special commission. My understanding from reading it is that the one about expanding to educators would also include educational collaboratives, but I just read them recently.
Okay, great.
Thank
you for your testimony, and thank you for coming from Western Mass. The only time I go to Sunderland is to go to Bub's Barbecue, so it's a nice spot. So thank you for coming in today, and thank you for your testimony.